Greetings, friends.
Hi, everyone. My name is Alyssa Trench. I am here with United Way, and today I am here with the Connected Together project, speaking with Fitzroy and Ali regarding this project. We know that the program goal for this is to mitigate the harmful impacts of early trauma and adversity here in Lebanon County. And to speak about this three-prong approach is Ali and Fitzroy. So can one of you, whichever one would like to begin, we'll see, start by telling us what the Connected Together Lebanon County project is. Ali, I guess we'll start with you.
I think that's actually, I was going to suggest, let me get this started and then we'll let Fitzroy kind of take it away, because truly in just the 2 weeks that he has been on board as our Connected Together project coordinator, he has taken the initiative and made it his own and has a lot of really great ideas that he's going to tell you about and put into play. The Connected Together initiative and the projects that will come out of it is a collaborative effort under the Community Health Council of Lebanon County, in which we brought a lot of really great minds together to the table to really plan a targeted, community-based approach to preventing multiple forms of violence and to helping to create a safety net for violence that's already been experienced or trauma that's already been experienced within our communities. And there's really 3 parts to the project, and I've come to understand them as sort of the short, medium, and long-term efforts that go into a holistic look at violence prevention. So in the immediate short term, right away, right now, we have access to mobile trauma therapy provided by Empower the Mind, which is the countywide SARCC provider. And that's available to anyone in our community at absolutely no cost. There's no strings attached. There's no insurance requirements. You can get connected right now, right away with a trauma therapist to help support you. And this was really set up because we have a lot of great resources in our county, but we also know that trauma is often intergenerational. And while there may be services available to support young people in our county, there are often not the same services for adults and access to services for adults. And so this really expands, and both children and adults can take part in it. We also wanted to make sure that we were building the capacity of local mental health providers to identify and treat these traumas, because they're so prevalent. About 65% of adults in our country experience some form of adverse childhood trauma or experience. And as we know, violence begets violence often. So if you are exposed to one kind of trauma, it increases your risk for additional traumas in your lifetime. And so we want our local service providers to have access to training to provide evidence-based treatment for trauma as well. And then the biggest part of this grant, and the part that Fitzroy is going to take us off and away in talking about, is our Connected Together project that will engage community leaders in 4 key communities in Lebanon County and really build the superheroes of violence prevention for these communities and train them on best practices, give them a chance to look into the data, to really dig into the resources available in the community, and to plan a community-based violence prevention strategy.
That's great. Fitzroy, do you have anything to add to that?
No, I think Ali did a really great job in presenting what the initiative is about. So I'll let what she said rest and then just continue to expand on the initiative that's connected together.
That's great. All right. And now, why is it that Lebanon County is in need of these services? Can you explain what the initiative was to get this rolling here in Lebanon County?
Yeah, so as Ali said, it's recognized that we have an issue ongoing in just life in general, but of course specific to Lebanon County, where trauma begets trauma. And from a study that the United Way had done, the ALICE study, it identified that there are 4 communities in Lebanon that are highly at risk, simply because of the factors of poverty, and stress that these communities currently engage. We see it as an onus on each one of us to do whatever we can to help our community members experience a better future. And so starting with the information that we have from the ALICE study, that has given us the incentive to really propel forward any engagement that the community can support to help each other do better, because we are indeed connected together. Yeah.
Yeah, absolutely. Now, can you tell us who is currently involved and what is the potential for expanding this? Like, who can be involved in the future, and is this something that you hope will expand?
Yeah, so currently, if you go to the Community Health Council website, you will see that under Connected Together, there are a number of groups that are currently part of the coalition. So we have the United Way as a partner. We have SARCC, which is the Sexual Assault Resource Counseling Center. We have Empower the Mind. We have Domestic Violence Intervention. And there are a large number of groups are already involved. They are the ones who initiated the planning to present this initiative in the community. But we also understand that each and every one of us have a part that we can play. We don't have the liberty of being innocent bystanders. We need to engage with each other if we're going to be able to really make a difference in our community. So everyone can participate, because every one of us is already participating in creating our community, right? By default, we are members of the community and we are already participating and creating it. So what we are intending on doing is presenting a framework that gives direction to each one in a specific part that they can engage in to make things better.
Wonderful. That's great. Fitzroy, I think you're such a gem in our community to begin with. That was a good explanation. So thank you. You both certainly are, but I always enjoy hearing from you, Fitzroy.
Yes, thank you.
You're welcome. Now, can you give us a little bit of a broader example of what this mobile therapy is? What does that mean exactly, the mobile therapy?
That's a really good question. So mobile therapy is a specialized trauma therapy that's provided in safe locations, and that can be virtually any location in the community. It could be at a school, it could be in the community at a library in a private room. It can also happen in offices. So Empower the Mind is our trauma therapy provider. SARCC also provides trauma therapy for sexual violence specific traumas. But we can go out to meet people at their doctor's office, for instance, if that's the most convenient place for them to get to. The idea with mobile trauma therapy is that it gets beyond traditional outpatient services where therapies are limited to like 45 to 50 minutes. It's very much bound by insurance requirements. There's often people have to travel to the therapist's office, so transportation can be a barrier to accessing it. And the idea here is that the therapist can actually go to the person and provide the specialized service that they need specific to their trauma. This is an effort to increase access to qualified care and to break down barriers like affordability or transportation, and also help our community to understand what's available and that healing is possible after a trauma.
Great. Now, how can people connect to this service if it is something that they are in need of and that they're interested in?
Right. So there's two ways that people can get connected. And as Fitzroy said, and I actually shared it in the private chat, so hopefully we can share it on the Facebook page as well. The Community Health Council has 2 referral forms set up on their website, and people can either do a self-referral where they say, hey, this is something I'm interested, I want to learn more, fill out the form through the Community Health Council website and submit that, and it goes to Empower the Mind therapist to be evaluated and to be contacted. Or If you are already working with a mental health service provider, for instance, or a doctor's office is someone who is connected and providing services but wants to coordinate care or get additional access to service, there's a professional referral form as well, so that agencies can make a referral on behalf of someone that they feel could benefit from this service. And that could be for any number of reasons. Could be that there's a need for a more specialized trauma focus. It could be that waiting lists have been a barrier to accessing therapy already. It could be that someone was simply not comfortable reaching out, but maybe they feel comfortable talking to their doctor about something that has happened, or to a teacher or a principal or school counselor about what's happening. So those two online referral forms are great options. And then I'll also leave it so there's no wrong door when it comes to accessing these services. So if people reach out through Fitzroy, for instance, or call the SARCC hotline at 717-272-5308 and ask about it, we'll find ways to connect you directly with the services that you need.
Great. All right. Now, as this effort begins, do you have a specific area of focus that you are going to, be a little bit more focused on, whether it be in the community or perhaps needs focused? Is there an area maybe that you're a little bit more focused on?
Well, due to the study that was done that we're using as the jumping off point for the work that we're going to do in Lebanon County, Myerstown, Lebanon, the city of Lebanon, Anvil Township, and Palmyra were identified as 4 communities that are at higher risk. And, sometimes when we look at numbers, they can seem sort of innocuous in a way. Mm-hmm. But if you translate those numbers and you consider that, for instance, in Myerstown, 1 out of 3 individuals you encounter is going to be an individual who is at risk, according to the stats from Alice. In the city of Lebanon, it's 3 out of 8. In Anvil, it's 2 out of 5. In Palmyra, it's 3 out of 8. So you're in Myerstown and you encounter in your little stroll through Main Street, you encounter 3 people. 1 of those 3 is possibly someone who's affected by ALICE. That means they are at greater risk for various trauma, and therefore those high numbers in those communities impel us to begin taking actions there, because we believe that they are where we should focus initially. However, we intend to bring this out to as many individuals in Lebanon County as possible.
Absolutely. Wow. Those numbers are hard to hear. I think, as we dig into Alice a little bit further, we know that about 38% of Lebanon County fits in that Alice category. And that is certainly something that has really, come to our attention here at United Way. And I know throughout other nonprofits in the community. So it's just so important. And I'm so glad that we're really digging into this. Now, I'm sure other people who are listening to this who aren't necessarily connected to our work, they probably want to know, how can they help? What can people do in the community to get involved and to really help with these efforts?
Yeah, so I'm glad that people are wondering, what can I do? Because the reality is that, to a great extent, maybe, and this election probably has made people more conscious of the fact that ultimately, we may have the responsibility, because we have abdicated our responsibility to a great degree by depending on someone else to take care of the issues that we see in our communities. So maybe now we can more readily embrace the idea and the fact that each one of us can engage to one degree or the other, right? And so individuals can volunteer to take a leadership role, but some people are not comfortable being at the forefront of a project. They can also engage by joining the discussion. Each person's voice is important. Every member of the community has an opinion. You have value, you have worth, and therefore your voice matters. So if it's only showing up to a meeting to give your perception of where the greater problem lies, and you want to be able to maybe volunteer to address a particular issue, Whatever you identify as an ability that you are willing to set forth, you are an asset, and you simply need to let us know that you are interested in helping and serving in some capacity, and we will find a way for you. We will make a way for you if you care enough to venture forth.
That is certainly the truth in nonprofits. I mean, anybody who has any kind of interest, we always want you, right? We always want people.
Yes.
So true. All right. And now my last question to you all is, what will the Connected Together community boards be doing for this project? Can you share that information?
Sure.
So Ali, did you want to? I'm sorry.
Yeah,
Okay,
I can get us started, and then I know Fitzroy, you have a vision for it as well. When we sat down all together, and there's some key community partners who are really involved with, coming up with this big picture idea for how community violence prevention can look. So that's included SARCC, the Community Health Council, Empower the Mind, United Way, and Domestic Violence Intervention. All of them are organizations that in one way or another were responding to trauma and treating it already, or we're working really closely with our communities to prevent violence or trauma of some kind, or some combination of the two. And what we know from that is that to do really long-lasting root work when it comes to violence prevention, you have to do work that is by and for and of the community that you're serving. And so if we had come into this with the idea that we're going to buy one curriculum that's going to work for all of Lebanon County and implement it everywhere in the same way, there would be consistency in implementation, but it wouldn't be a tailored approach that responds to the unique needs and strengths and values of the different communities that we're in. Because walking through any one town in our county, there's different business owners, there's different things that are important, there's different churches that are really involved or invested. And we want to respond individually to each of those things. And so when the group of community partners who developed this grant sat together at the table, we were looking at ways that we could build a targeted community prevention strategy, and really identified that the communities that care model would be a really valuable way to build buy-in and build some intentional community interventions that look at data, that take into account the existing resources that are in a community, and also take real stock about what communities need. And we wanted to make sure that we were getting the real stakeholders, the average citizens who are living and working and raising their children in these communities, involved and invested in the work. Because while, Fitzroy and I are paid to do work that we're really passionate about, it's different when you're talking about the neighborhood where your children are playing, or where your elderly parents are living and you're trying to help to support them. And so we wanted to use this communities that care model. And I think Fitzroy can talk more about what he hopes the community leaders who get involved with this model will be doing and seeing.
Yeah, so as Ali said, it's possible to just give a model and say, well, everyone has to implement this model. But tying back to the question that you asked previously, what can each person do? Well, we recognize that the individuals who know the community best, who are probably more passionate about what's occurring in the community, are the individuals who live within each one of those communities. So we are not coming in and trying to enforce some methodology. What we are saying is we believe you know best your community and how best it can work and benefit from a model that will allow you to identify, discuss, and then find methods to solve the issues that you face as a community. And we are there to facilitate the process. We are there to provide you with guidelines and direction. However, each community will be deciding for itself what it considers to be the key concerns and how they would like to address them in what order. And so the community leaders will be individuals leading the discussion, facilitating the discussion, and guiding the opinions and ideas that people give to create a consensus that would serve as a framework to engage in solving the issues and making the community better, safer, healthier, and far more responsive to the needs of the citizens in each community.
Yeah, that's so important. And I think that's so important as we think about this, is that this is not a one size fits all model, as you're explaining. And if we think about Lebanon County as a whole, I mean, we have a small community for sure, but it's really diverse. I mean, when we're talking about an area like Lebanon City and the needs that may be there, as opposed to, rural Anvil, there are certainly, differences there. So I think that's just such a wonderful approach that you're taking. It makes a lot of sense. We did get a question from a viewer. Jacob Meyer wanted to know, do you still have a single location that we can hand out to people to address different needs they may have? Do you want to answer that?
Yeah, so my first question, I think that can be answered a number of different ways. So it's always helpful to answer a question with a question, right? Right, Jacob? If people are looking for general community resources or ways to connect someone with different service providers or food access or childcare options, the United Way offers a 211 service that is accessible 24 hours a day for warm referrals and handoffs. So if you're just looking for general services or general support, or you're not entirely sure what exactly it is that you are needing, 211, which you just dial on any phone that you're using, will get you connected to a trained referral counselor who can assist with that. If you are looking for, is there one location where someone could go to get connected with these mobile trauma therapy services? SARCC offices do have a physical location at 615 Cumberland Street in Lebanon. And we have someone posted in our office Monday through Friday, 9 to 5 for walk-in services or support. If you come in, you ask for assistance getting connected to the mobile trauma therapy, folks there can assist you. And then we also mentioned we have our 24-hour support line at 717-272-5308. And that's been up and in existence for a long time. We've been providing 24-hour access to sexual assault counselors since SARCC first came into operation back in the 80s. This just allows us to build some additional warm referral into it if the issue or the trauma that you're working with or related to is not sexual violence specific or sexual violence limited. A great example of this, so we have our partner agency, Domestic Violence Intervention, which is the domestic violence shelter and provider in Lebanon County. And if someone is experiencing domestic violence or family violence, but it's not sexually violent in nature, they may still need trauma therapy or want trauma therapy to help work through the impacts of that violence that they've experienced. And this would allow them to get connected to a licensed therapist through Empower the Mind to have no-cost services that can happen in conjunction and in correlation with any shelter services or advocacy services that they may be receiving through domestic violence intervention. What is interesting about this work is that, trauma can look any number of different ways and affects people differently. There's not a right or a wrong way to experience trauma or to heal from trauma. And so we may have people in our community who have past trauma from an accident or a difficult childhood growing up, or having a family member who struggled with addiction, things like that, that may have had significant impacts on them, but they maybe didn't fit into a box for insurance or for different human service providers. And this kind of expands the access to services for those folks. For people who are interested in getting involved with the Connected Together community leader teams, if you contact Fitzroy, and Fitzroy, if it's okay with you, I would love to share your email address at SARCC or the general SARCC email if you're not comfortable. Oh, great. Thank you. You can reach out to Fitzroy, and he's building his teams as we speak. So he is going to meetings, pounding the pavement and getting connected with people in these 4 key communities. And we really see this as a pilot opportunity. So we're testing this out in the 4 communities that are at the highest risk, according to the Alice report. But if things go well, or we learn a lot from this work in our community leader development process through the Communities That Care model, hopefully we can take it to Jonestown next, or out to Cornwall Borough, and find different ways that we can do this targeted prevention work and capacity building that supports the communities as we keep growing.
So if I may, I'd like to add something. So one of the things that I was really impressed by when I began working in Lebanon about 4 years ago is the large number of individuals who are so passionate about serving and helping others. And there's a really strong group that's oftentimes engaged in almost any calling to go out and give a helping hand and to support another coalition to do their project and complete their work. So in Lebanon County, there's a great deal of caring and concern, but many times people don't know what they can do and how they can actually use their strengths. And so we absolutely encourage you, if you have any interest, reach out to us, and we may not have something that you are able to do right away, but the fact that you are interested lets us know that we can call on you when we do have an opportunity within your community, or whether it's something that you have a particular strength in and you want to just be part of the larger team that oversees the entire project. We have a place for you, because you, as a member of the community, you are an asset. You have benefits and you have skills that you can contribute. And we want to encourage everyone to dig in a little bit and see where you can be of service to the others in the community.
Absolutely. Absolutely. Well, I would like to thank both of you, because this was so informative. And I think that this is just such a wonderful project that you guys have started here. It's certainly very needed in our community. And again, just thank you both for all you do every day for Lebanon County. We really are so proud to have you in our community. Is there anything you'd like to add, or anything else you need to say before we go?
Well, like I said before, you reach out to us at SARCC. You can reach out to us online, or you can call us and let us know where you are, what you're interested in doing, or what you are concerned about, and we will find a place where you can be of assistance.
Wonderful. Great.
Absolutely. And last thing that I would say is that prevention is possible. There's hope in this work, and I know our community can do it.
Absolutely. I agree. We have a pretty great community out there.
Yeah.
So, all right. Well, thank you so much for your time today. I'm sure everybody enjoyed hearing more about the project, and we look forward to more good work coming from you all in the future. So thank you.
Well, thank you, Alyssa. Thank you to
Alyssa.
the United Way for giving us the opportunity to talk about this.
Oh, it's our pleasure. Thank you, guys. Have a great day.
Yeah, you too. Thank you.
Take care.
Bye.